So you've probably heard about epilepsy, but how much do you actually know about it? Here to educate us a little bit on what it is and what it isn't is Dr. Danielle Becker. Doctor, thanks for joining me.
Thank you for having me.
Let's start with a pretty broad
So what people don't
definition
realize
of
is
it. Let's talk about epilepsy as what it is.
So the word epilepsy is actually used to show that a patient may have a predisposition to have more than one seizure. And a lot of people don't realize how many people have epilepsy in the United States. More than 3 million people. In fact, 150,000 new cases are reported every year. And to break it down, 1 in 26 people will develop epilepsy at some point in their lifetime.
Wow. So what do patients experience both, socially, physically, etc.?
So patients are affected physically with their seizures, but also emotionally with isolation, socially with relationships, financially with jobs. So there was a national survey that was conducted to look at the state of epilepsy as well as improve communication between patients and their care teams. And what it found was more than 3 out of 4 patients will say they struggle to feel normal because they're constantly living in fear of when their next seizure would be. And they feel isolated. And sometimes that's because they can't drive. And so SK Life Science has partnered with the Epilepsy Foundation to provide a rideshare service during the month of November where they're paired with Uber and there's a voucher, and you can find out more information about this at webmd.com/epilepsy survey.
And you talk about a strong relationship between patient, caregiver, healthcare professionals, etc. Why is that important?
It's important because there's a partnership between patients and professionals, healthcare professionals. And if the partnership isn't there, it's hard to give the patients the best care they need. So with the survey data, it actually showed that patients, more than 50%, are not sharing their life goals with their physicians. In fact, they're not even necessarily telling the physician how many seizures they're having because they think the physicians are more focused on type, and or they may not know that their seizures are severe enough to communicate them. So there was a tool that was developed from the survey data that patients and anyone in the epilepsy community can go and download at webmd.com/epilepsy survey and fill out before they even go into their doctor visit so that they can have the best care and also the best communication during that time when they're sitting down with their healthcare professional.